we have to do as dentists, we're going to have to actually say, all right, this is what you have. These are your options. Now, what do you think the options would be? Especially with a tooth like this, where the upper front tooth comes out. When they come out like that, what are the options with something like this? But you got to make sure that you're going to a dentist where they can actually fix this tooth, because you got to go to a dinner date tonight. Like right now, the options are. So when we get a patient calling our office, sometimes I don't know what the person wants to do, and I'm thinking like, okay, well, what do you want? Because they're always telling me. Remember, I was saying they're always telling me what are my options, and they always tell me what's the best, right? They go, what's the best? Like, I could tell you the best, but the question is, are you going to do the best? Because if you've got a situation like this, right? You got a situation where, a person, not young, I'm talking about somebody over 60, people with dentures, people with partial denture, people with bridges, people with crowns, they've had so much dentistry done, and they come in and they say, what can I do? Especially when they break a tooth just like this. So when we break a tooth, they come in with a break a tooth, and then they have a history of breaking teeth already. So I'm going like, what can I do? And then I already know the history of this situation, and then they will say like, what's the best thing to do? And I'm going like, even if I tell you what the best thing to do, I'm not sure if you're going to do that. So what we have to do as dentists, we're going to have to actually say, all right, this is what you have. These are your options. Now, what do you think the options would be? Especially with a tooth like this, where the upper front tooth comes out. When they come out like that, what are the options with something like this?
Implant, bridge, partial denture.
Yes, but I have a party to go to this weekend. Like, how long those gonna take?
Yeah.
How long is the bridge gonna take? How long does the bridge take?
2-3 weeks.
2-3 weeks after you prepare it, right? But they have a party to go to over the weekend, and they break a tooth. What are you gonna do? What are you gonna do? What is the dentist gonna do?
They have a partial to add teeth to the partial.
That would be one, right? Add a teeth to the partial that day. Now, you're going to have to find a dental office that's going to be able to do this in their office. Most dentists now, they're going to have to send it to the lab. Is that what they're doing?
Yeah.
In dental school, they might be teaching a lot in lecture. But are they teaching it so that they can go ahead and do this in their office? Maybe, maybe not. I'm not sure. But you got to make sure that you're going to a dentist where they can actually fix this tooth, because you got to go to a dinner date tonight. Like right now, the options are, when you break a tooth like this, the options are a bridge, partial denture, dental implant. How long is that going to take? How long is that going to take? A long time. A dental implant takes 4 months to 6 months after it heals when you pull it out. It could take a year to do. A bridge could take a little quicker. A bridge could take 2 to 3 weeks, but then a partial denture, you have to send it to the lab to be fixed. That could take a month. But this person has a party to go to this weekend. Tonight, what are you going to do? What would be their option? Go to the party without a tooth? Or don't go to the party, right? All right, so you have to fix this, and in our office, we're able to fix it that day. To add a tooth to existing partial denture, so that they could go on to a party this weekend, and then start planning on what needs to happen to this area long term. Then you can start discussing, is it a partial denture? Is it a dental implant? Is it a bridge? And then you're gonna have to tell them how much is it gonna cost. Because what's best for one person is not best for another person. And when somebody says, what's the best? You better find out what's going on with that person's situation, because the best has to do with how much time, how much is it going to cost, and I'm afraid to go to the dentist, right?